Have you ever stood up from your chair and felt the room tilt? Have you ever reached for the wall in the middle of the night, just walking to the bathroom? Have you ever felt wobbly on your feet and told yourself, this is just what getting old feels like? Well, I need you to stop right there, because that thinking could be putting your life at risk. Welcome back. Today we are talking about one of the most ignored warning signs in people over 60, balance problems. Most people think losing their balance is just a natural part of aging, but doctors are now saying something very different. Balance problems are not just old age. In many cases, they are your body sending you a serious warning signal, a signal that something hidden is going on inside you. Today, I am going to walk you through the top hidden health conditions that cause balance problems in people over 60. I will tell you the warning signs to watch for, and, most importantly, what you need to do right now. Stay until the end, because the last cause on this list surprises almost everyone. Let's get into it. Before we talk about the causes, let me tell you why balance problems deserve serious attention. Your body's balance system depends on three things working together at the same time. First, your eyes. They tell your brain where you are in space and what is around you. Second, your inner ear. Deep inside each ear is a tiny system that detects movement and the position of your head. It sends constant signals to your brain like a GPS. Third, your nerves, muscles, and joints. The nerves in your feet and legs send signals to your brain about where your body is positioned at every single moment. Doctors call this proprioception. When even one of these three systems fails, your brain gets confused. And when your brain is confused about where your body is, you feel dizzy, unsteady, or you fall. And falls are not a small problem. Falls are the #1 cause of injury death in adults over 65. Every year, 1 in 4 older adults falls. Many of those falls result in broken hips, head injuries, and long hospital stays that change a person's life forever. But here's the most important thing I want you to understand today. A fall is not the problem. A fall is the result of a problem. Balance issues are your body's way of telling you something is wrong. Something needs attention. So let's talk about what that something might be. The first hidden cause of balance problems in people over 60 is an inner ear disorder. The most common one is called BPPV, benign paroxysmal positional vertigo. Let me break that down simply. Benign means it is not dangerous on its own. Positional means it is triggered by certain head movements. And vertigo means that spinning sensation, where the room feels like it is moving even though you are standing still. What actually happens inside your ear? There are tiny calcium crystals inside your inner ear that normally help detect gravity. In people with BPPV, these crystals get displaced and move into the wrong area. Every time you move your head, these crystals send false signals to your brain, causing that spinning, dizzy feeling. You roll over in bed, and the room spins. You tilt your head back, and you feel dizzy. You stand up quickly, and you grab the nearest surface. BPPV becomes more common after 60 because the inner ear naturally changes with age. Warning signs to watch for: sudden, intense dizziness triggered by head movements, a spinning sensation that lasts less than 1 minute, nausea that comes with dizziness, and feeling unsteady after rolling over in bed. The excellent news is that BPPV is one of the most treatable causes of balance problems. A doctor or physical therapist can perform a painless procedure called the Epley maneuver, a specific series of head movements that guide those displaced crystals back into the correct position. Many people feel significantly better after just 1 or 2 sessions. There is also another inner ear condition called Meniere's disease, which involves a buildup of fluid in the inner ear. It causes episodes of intense vertigo lasting 20 minutes to several hours, often combined with ringing in the ears and hearing loss. Meniere's disease is treated with dietary changes, medications, and sometimes minor procedures. If your balance problems involve spinning or dizziness triggered by movement, please see a doctor and ask specifically about inner ear disorders. The second hidden cause surprises many people: blood pressure and heart problems. Most people know high blood pressure is bad for the heart and brain, but what many people do not know is that blood pressure issues and the medications used to treat them can directly cause balance problems. Here is something very important that many people over 60 experience without knowing what it is. It is called orthostatic hypotension, and it means your blood pressure drops suddenly when you stand up. Here is what happens. When you are sitting or lying down, your blood pressure is stable. The moment you stand up, gravity pulls blood down toward your legs. Normally, your body quickly compensates, but in older adults, this compensation becomes slower. The result? For a few seconds after standing, not enough blood reaches your brain. You feel dizzy. The room goes gray. You reach for the wall, and sometimes you fall. This happens at the most dangerous moment, right when you are starting to move. Common causes include dehydration, blood pressure medications, diabetes, and prolonged bed rest. Always stand up slowly. Sit at the edge of the bed for 30 seconds before rising. Hold on to something as you stand. Drink enough water throughout the day, because older adults often do not feel thirst strongly enough and become dehydrated without realizing it. Now, beyond blood pressure, there is also a heart rhythm problem called atrial fibrillation, or AFib. AFib means your heart is beating in an irregular, chaotic rhythm instead of a steady beat. This reduces the blood pumped to your brain, and the result can be dizziness, lightheadedness, and balance problems. AFib is extremely common in adults over 60, and many people have it without knowing. It also dramatically increases stroke risk, so it must be diagnosed and treated. Signs of AFib include irregular heartbeat, dizziness, shortness of breath, and fatigue. If you have balance problems, your doctor should check your blood pressure both sitting and standing, and should evaluate your heart rhythm. The third hidden cause involves the brain and nervous system. And this is one area where early detection makes an enormous difference. Let's start with Parkinson's disease. Most people associate Parkinson's with shaking hands, but balance problems are actually one of the most disabling aspects of Parkinson's disease. People with Parkinson's often develop what doctors call postural instability, difficulty maintaining balance while standing or walking. They may walk with a shuffling gait, a stooped posture, and have trouble making quick balance adjustments. Parkinson's also causes something called freezing, where the person suddenly cannot move their feet even though they want to. This commonly happens at doorways or when changing direction, and is a major cause of falls. Other early warning signs of Parkinson's include a slight tremor in one hand or finger, smaller, cramped handwriting, loss of smell, acting out dreams during sleep, soft or slurred speech, and constipation. If balance problems come with any of these signs, see a neurologist. The good news is that Parkinson's disease is very treatable, especially early on. Medications can significantly improve symptoms, and physical therapy can help maintain balance and prevent falls. Now let's talk about something far less known, but critically important. It is called normal pressure hydrocephalus, or NPH. NPH occurs when cerebrospinal fluid builds up inside the brain, putting pressure on it from the inside. It is often mistaken for Alzheimer's disease, but unlike Alzheimer's, it can actually be treated surgically. Doctors describe NPH with three classic symptoms, sometimes called wobbly, wacky, and wet. Wobbly, a shuffling, wide-based walk, as if the feet are stuck to the floor. Wacky, memory problems, confusion, and slowed thinking. Wet, loss of bladder control. If you or a loved one has balance problems, plus memory issues, plus bladder problems, please ask your doctor specifically about NPH. A shunt procedure can drain the excess fluid, and many patients see dramatic improvement in all three symptoms. And finally, mini strokes, also called transient ischemic attacks, or TIAs. A mini stroke is a temporary blockage of blood flow to the brain. Symptoms, including sudden dizziness and balance problems, may last only minutes, then disappear. But a TIA is a major warning sign that a full stroke may be coming. If balance problems or dizziness come on suddenly, especially with face drooping, arm weakness, speech difficulty, or sudden severe headache, call emergency services immediately. Do not wait. The fourth hidden cause affects tens of millions of people, many of whom do not even know they have it. Diabetes and the nerve damage it causes is one of the leading hidden causes of balance problems in older adults. Here is how it works. Chronically high blood sugar slowly damages the small blood vessels that supply nerves throughout the body. This is called peripheral neuropathy. Remember, balance depends on signals from your feet and legs telling your brain where your body is positioned. Peripheral neuropathy disrupts exactly those signals. The nerves in your feet become damaged. They send weak, delayed, or incorrect signals to your brain. You cannot feel the ground properly beneath your feet, and your balance becomes dangerously unreliable, especially in the dark, where your eyes cannot compensate. Signs of diabetic nerve damage include numbness or reduced sensation in the feet, tingling or burning in the feet and legs, sharp or stabbing pain in the feet, muscle weakness in the legs, and balance problems, especially at night or on uneven ground. Controlling blood sugar is the most important step. It can slow or even partially reverse nerve damage. Physical therapy and balance training are also essential. If you have diabetes, please make sure your doctor knows you are experiencing balance problems. Ask for a full neurological evaluation. Even if you have not been diagnosed with diabetes, if you have risk factors like excess weight, family history, or high blood sugar, get tested. Diabetes often progresses silently for years. The fifth hidden cause is nutritional, and it is extremely common in people over 60. Two vitamins in particular are directly linked to balance problems. Vitamin D is essential for muscle strength and coordination. Low levels lead to leg muscle weakness, which directly impairs balance. Vitamin D deficiency also slows your reaction time, meaning you cannot catch yourself as quickly if you start to fall. After 60, vitamin D deficiency becomes very common because we spend less time outdoors. Our skin is less efficient at producing vitamin D from sunlight, and our kidneys are less efficient at processing it. Studies show that correcting vitamin D deficiency in older adults can significantly reduce fall risk. Now, vitamin B12 is essential for nerve health. Deficiency can cause numbness and tingling in the hands and feet, balance and coordination problems, memory difficulties, and fatigue. Older adults are particularly at risk because stomach acid, which is needed to absorb B12 from food, decreases with age. People taking metformin for diabetes or acid reflux medications are also at higher risk. Both vitamins are easily tested with a blood test and are straightforward to treat with supplements or injections. Please ask your doctor to check both your vitamin D and vitamin B12 levels, especially if you are experiencing balance problems. This next cause is one of the most overlooked and one of the most fixable. By age 65, the average person takes 5 or more prescription medications every day. And many of these medications, alone or in combination, can cause dizziness and balance problems. Blood pressure medications, especially beta blockers and diuretics, can cause dizziness when standing up. Sleeping pills and sedatives, including medications like Valium and Xanax, cause drowsiness, slowed reactions, and impaired coordination. Older adults are especially sensitive because the body processes these medications more slowly with age. Common allergy and sleep medications containing diphenhydramine are highly sedating in older adults and significantly impair balance. Certain antidepressants can cause dizziness and balance problems, and diabetes medications, if blood sugar drops too low, cause dizziness and shaking immediately. Bring every medication you take, including over-the-counter drugs and supplements, to your next doctor's appointment. Ask directly, could any of my medications be contributing to my balance problems? Do not stop any medication on your own, but do have this conversation with your doctor. A simple dosage adjustment or medication switch can sometimes eliminate balance problems completely. All right, let me bring everything together for you with a clear, simple action plan. Do not ignore balance problems. Any consistent dizziness, unsteadiness, or unexplained fall deserves medical attention. Do not write it off as old age. See your doctor and be specific. Tell them when it happens, what it feels like, how long it lasts, and any other symptoms that come with it. Ask for these specific tests: blood pressure both sitting and standing, blood tests for vitamin D, vitamin B12, blood sugar and thyroid, an EKG for heart rhythm, and a vision exam. Ask for a medication review. Bring all your medications and ask if any could be causing your balance problems. Ask about a referral to a physical therapist who specializes in balance rehabilitation. Balance training and strength exercises can make a dramatic difference, and they work. And make your home safer right now. Remove loose rugs. Install grab bars in the bathroom. Keep hallways well lit. Wear supportive, non-slip shoes. Now, let me leave you with something important. Balance problems are not something you simply have to accept. They are not just old age. They are a message from your body, and that message deserves to be heard. Every single cause we talked about today, inner ear disorders, blood pressure issues, neurological conditions, diabetes, vitamin deficiencies, and medications, every one of them is diagnosable, and most of them are treatable. You deserve to feel steady on your feet. You deserve to move through your life with confidence and without fear. So please, take this information to your doctor. Ask the questions. Advocate for yourself. And if this video helped you today, share it with someone you love who is over 60, because this information could prevent a fall that changes their life. Thank you so much for watching. Take care of yourselves, and I will see you in the next one.